Hi doctor, during the pandemic, it's never really felt like the right time to go to the eye doctor because I don't wear any glasses and my vision seems to be perfectly fine. Is this an appointment that's important to go to, or is it okay to skip?
Sabrina, they say the eyes are the window to the soul, but they can also be the window to a serious medical issue. Eye doctors can often see clues in the eyes that are a warning that something serious is happening elsewhere in your body. Here to talk about some of those warning signs is optometrist Dr. Bridget Anderson. Dr. Bridget, welcome to the show.
Thanks for having me.
How often do you spot serious medical conditions with a patient who's just came in actually just for a regular eye exam?
Yes, probably every week. Not too long ago, I had a young man come in and his main complaint was dry eyes. And pretty quickly into the health portion of the exam, we uncovered that he had very severe diabetic problems going on in his eyes. And he had no idea he even had diabetes. A few years before that, I had a woman come in who was complaining of headaches and some double vision. And very quickly into the exam, we sent her immediately to the hospital for an evaluation for a brain aneurysm.
Tell us, Dr. Bridget, some of the hidden causes that you may pick up in somebody's eye.
So some of the big causes that will show themselves as inflammation are rheumatoid arthritis, Crohn's disease, ulcerative colitis, lupus, psoriatic arthritis. There's a long list, but those are some of the big ones that we can catch as inflammation in the eye.
You also brought a really good example of what high cholesterol can look like on the outside of the eye. Take us through that.
Yeah, so this is a picture. It's called xanthelasma, and those kind of yellow spots you see there, those are deposits, lipid or fat deposits on the front of the eye, and this is typically related to high cholesterol. Just last week, I had a patient come in with this, and during the exam, I said, have you been diagnosed with high cholesterol? And he kind of paused and said, well, maybe kind of borderline a few years ago. And I said, well, you need to go back and get your blood work done again, because my guess is that it's high.
We're living in uncertain times. It's tough to keep up with the latest medical headlines.
About the market, panicked about COVID.
And how do those headlines impact you and your family?
100,000 people died.
On season 13 of The Doctors, we want to empower you physically.
If I met them at dance, they would meet me at medicine.
Man, I love that. Emotionally.
If I could change my thoughts, I can change my feelings.
And medically.
He doesn't have his mask up, which is not a good thing.
This is the $1 million question, maybe the $1 trillion question. This is so critical for people to hear. We're giving you the inside track on health and wellness so that you can get back to the life you deserve. It's time to take back your power. The Doctors, now more than ever. Premieres September 21st.